I'm glad to be here. Many of you know me. I'm Anna Natale Pereira. I'm a Division Director for General Internal Medicine, Associate Professor of Medicine, and the Assistant Dean for Primary Care and Community Initiatives. I'm very excited to be here, very glad that I was invited. I was not asked to talk about me, so I will talk very little about me, other than to say that I have been part of New Jersey Medical School my entire life. I came here as a medical student. I'm the sort of first class of the Hispanic Center of Excellence, and have been extremely supported by the process, by Dr. Soto Green, the dean, and it has been an incredible journey to still be here. Many times they tell you in academic medicine that to succeed you have to move on and go somewhere else, and so that you can grow. And I'm a firm believer that if you're committed to what you're doing and commitment to the community that you work with, you can continue to grow where you are. You just have to know why you're doing what you're doing. So with that, I will say that in this effort, I was asked to talk about where we are, what's our commitment to Latino health. And to do that, I thought of maybe giving you an 18-year sort of window of where we have been, and particularly what's the involvement of this institution in that process. I'll share some of that trajectory. So in 2000, so the first period, those first 6 years, so I went to medical school, I'm a class of 96, and I did my residency training 96 to 99, and I was a chief resident in 2000. Around that time, in the late 90s, is when there was a strong commitment and push through the Office of Minority Health to really understand Latino health issues in New Jersey. And the Office of Minority Health in the state of New Jersey started in the 1980s is when it was really commissioned. 1991 is when it became official. And in 2000, they had a historic summit that took place, which was titled A Call to Action for Eliminating Health Disparities for Latinos in New Jersey. And as a result of that initiative, many of us here were involved in that process. There were a series of recommendations that came to light at the state level. Governor McGreevey at that time created the Hispanic Advisory Council in 2002. And the recommendations that came out of that period of 2 years were focusing on three main things. One was to ensure access to care for the Latino community, obtain consistent and comparable data, which we still struggle to this day, but I think we have moved the needle a little bit on that in that arena, and to really be culturally and linguistically competent, and to push for cultural competency and linguistic competency across the provider spectrum. And so Dr. Soto Green have been very involved in that arena as well, because that also led to the push for the requirement for cultural competency for licensure in the state of New Jersey. So in that window of those first 6 years, we institutionally were involved in creating our interpreter program, working on health services research projects in the institution, and building community projects and building our community network. We used to have a practice at Focus Community Health Center, and that was our first practice, and really the focus was to practice at a community-based, in collaboration with a community-based organization that deliver pretty much care to an 80% Latino population in that area. And that project actually was successful because of the leadership at the institution and the commitment from the chair of medicine to really build a community expansion. In those days, you have to understand that the way that Newark functions, there was no, people don't necessarily cross the Penn Station line, we used to say. So people necessarily did not come up this way. So there was a real bridge to the community that didn't exist before. The 6 years that followed that, we were very much involved as an institution with University Hospital to push for class standards to ensure that those standards, which are national standards, actually took place in our hospital. we were able to take that interpreter project from being a grant project to actually being integrated into the university hospital and create a cadre of interpreters at the hospital level that will help with our biggest challenge, of course, which is our largest population, is the Latino community. Our clinics, even to this day, they're about 35% Latinos in our clinics. We were also part of a large initiative through CMS, which is a collaborative program, 5-year grant to look at disparities in cancer care among Latinos. And then also Dr. Herrera actually was the PI for this American Heart Association grant looking at Latino Simple 7 Impact Awards. So she received an award to look at diabetes and heart disease. Where are we now in the next phase in the last 6 years? I think we need to sort of close that loop and now continue to not only push on the research side, but also on the clinical environment to make it stronger. We have integrated, the CMS program was based on patient navigation of Latino patients. Those navigators then became another effort to integrate them fully into the clinical environment, and they have been instrumental in helping our patients as they come through the clinic. We also have a university hospital commitment through the patient advocacy office, and in the last administration, bringing John Duhare as a experienced officer who will take on this and elevate it to the next level, all of these areas. So we have been instrumental in the diabetes education program and in now the next phase of our population health initiatives. So this is where we are in the last, there's a very quick 18-year window, but as you look to where we are going, I think the most important areas is to continue our commitment. New Jersey Medical School is committed to community health and health systems improvement and focusing on all of our populations and certainly our Latino community. University Hospital through population health initiatives and continue to assess those culturally appropriate services that we deliver. And I think ultimately circling back to the Office of Minority Health and where they stand after this 18 years, right? Where are they going from there? And the State Department with their Center for Hispanic Policy Research and Development, which is a new initiative whose the director actually is Sarah Peña, who used to be here at University Hospital. So we have a great opportunity to push the agenda even further. Thank you.